I think there is a legitimate fear that you don't want to be alone in your healthcare journey entirely. I think a big concern people have is empathy, judgment. Where is the human in the future of care?
I think framing the question of will it be an AI or a doctor is just a false dichotomy. It will obviously be both.
If there was one thing that you wish people knew or understood about AI in healthcare, what would it be?
Stand by.
AI is transforming healthcare, and these changes are already in play. It's helping to predict diseases, it's helping to read scans, and helping doctors make faster and more precise decisions. And there's a lot of excitement about the dawn of personalized healthcare. But at the same time, there's some very real concern about the role of the physician and what happens to empathy and judgment in this new world. So today, I'm here to talk with Jonathan Carlson, VP of Health Futures at Microsoft, and he is on the cutting edge of this AI research, and he's helping to redesign what care and what health may look like in the future. So as a futurist, I was really intrigued to hear your title, VP of Health Futures at Microsoft. What does that mean? What do you do?
So at a high level, I lead our research team that focuses on health and life sciences. And we've been at this for 20 years or so, thinking about what is the future? How do we use computing to really advance human health? In the last decade or so, this has really shifted into how do we really use the emerging technologies of artificial intelligence, both from an application perspective, but what are also some of the fundamental learnings that we need to really push on from a technology perspective?
And how do you see the physician's role in collaboration with or evolving alongside AI? Because on the one hand, AI, it doesn't actually have tacit knowledge. It's not in the field. It doesn't actually have patients, but it has textbooks. The physician has patients and has read textbooks. So do you see a lot of overlap and synergies, or where do you see the tool working with or doing its own thing alongside physicians?
This is going to evolve. But if you think about what is so hard about medicine, you just practicing textbook medicine, how many textbooks are there in the world? How many specialties are there? Why are there specialties? There are specialties because no one human can understand all of medicine. It's just not possible. Even medicine as we understand it today, which of course is going to be different than how we understand it tomorrow. So already physicians use search engines. They use, Google search, but they also use medical specific search engines to stay up to date. One of the, I think, really immediate use cases of AI from a clinical perspective is just its ability to help physicians diagnose, make sense of the particular case in front of me, and then match it to what we already understand about medicine. And we're starting to see early academic studies showing that AI is very, very good at this. How we integrate that into practice is still a pretty open question. But the ability of models and AI to start working with physicians to start integrating the different parts of the information and being able to even just triage and say, no, this really is important. You do need to go to the urgent care right now. And being able to up-level those frontline physicians, I think will be super important. I think the most important thing is that we are really getting to better patient outcomes. Objectively, these systems are very good at things like medical diagnosis, and they're not perfect by any means. But I think we can see how that will start integrating directly into direct patient care.
And how do we think about the data? I mean, whether that's somebody asking an AI system a general question, or even just AI being an ambient technology in the room, how do we find that line of, because we're going to need more data to do personalized medicine, and we can talk about that in a second, but where do we draw that line around how much we should share with the system? Because once you give a generative AI system data, you can't get that back.
Yeah. And I think one of the important shifts that we're starting to see that I think we really need to push on is not ask who owns the data and is the patient giving consent, but how is the data being used as a public good, and how are we respecting the dignity of that data and giving patients choice to be part of that process? And how do we stop thinking about who owns the data, but who is the trustees of that data? Again, how do we think about this from a public good, balancing with personal choice and personal dignity? One of the things that I'm really excited and encouraged to see is that we're seeing patient groups becoming very involved with these discussions. We're seeing bioethicists becoming very involved with these discussions, and regulators. And I think it really is a societal discussion.
And I guess with that question, who also gets to benefit from the data? Because it could go into a public good data set, but to make sure that you were also the beneficiary of those answers and of those analytics.
That's right.
If you could explain the potential and the possibilities for the personalized era of healthcare, what that could look like and what we could be excited for.
Let me first ask, why do we want personalized medicine? To me, the fundamental problem with medicine is twofold. One, we just don't understand biology, and so there's a bunch of noise there. And the other is that we're really diverse. All of us are different, and yet medicine has to operate off of averages. And yet none of us are average. Every one of us has our idiosyncrasies, right? And so the goal of personalized medicine is to do the right thing for you, to do the right thing for me. Some of the great breakthroughs in cancer care, immunotherapies, only work at best 30 or 40% of the time, and we have no idea which 30 or 40% of the people. What we really need to do is get to the point where we can actually start predicting who's going to respond to this. But I think we often think about, well, how is AI going to predict this? It's not magic. It's got to learn from something. And I think the most important thing is to think about how can we use AI to structure unstructured information, right? We're already digitizing our encounters in the clinic. So in some sense, we already have the information about what's happening in medicine encoded digitally. The problem is it's a mess. It's total chaos. It's things that my physician has written down. It's PDFs. It's faxes that have been digitized. But AI is actually really good at taking unstructured stream of thought writing and structuring into a table. Once you do that, well, we have decades of understanding about how to use statistics to find populations that will respond or not to respond to treatment. We can start using that to identify biomarkers to say, hey, this person is 30% likely to respond. This person is 70% likely to respond. And then we can start using that to find subpopulations to get more and more precise care. Not just say, okay, this person is going to respond, but these people are not responding. What is it about the biology? And now we have a discovery program to go on and find medicine.
If a patient needed to get something diagnosed, do you have any studies of what this could look like in the future in a world where AI and AI agents are more prevalent?
Yeah, the whole idea of agents is fascinating. It's becoming kind of a buzzword. But another way to think about it is how do we just decompose a problem and ask instances of AI to play different roles? So two different examples. One really simple one. If you ask a model to get to a diagnosis, but also think about costs at the same time, it'll kind of get itself confused. But if you say, you know what, I'm going to ask 5 different instances of a model to role play, they'll actually get to a much more reasoned, sort of multi-purpose answer. When care is working at its best, cancer care, for example, you'll see your oncologist. And once you go through the textbook medicine, you'll run into the endpoint where you say, well, I don't know what to do next. What do we do? Well, they'll bring your case to a multidisciplinary tumor board. And that's literally a room full of a dozen specialists, radiologists and pathologists and geneticists and people thinking about clinical trials. And there'll be this whole effort to say, okay, let's pull in everything we know about this patient. Let's look for clinical trials. Let's look for the latest research. You can actually decompose that in an agentic way in terms of having different models, a model that understands pathology images and a model that understands clinical trials. And you can design systems then that can actually go off and pull together the information needed to inform the tumor board. You can turn that into an interactive experience where they can interact with the physicians. Right now, that's being used to prepare for tumor boards. I think in the future, we have an opportunity to bring this technology, again, to resource limited settings where you don't have access to 12 specialists, and you can start giving some of this information to the frontline care workers.
So essentially you're saying Microsoft set up a study where they put a team of AI agents that one would be like a cost center in a hospital or in an insurance room. The other would be a specialist in this field and the other a specialist in something else. And the AI agents themselves deliberated on the best course of action for the patient.
That's right. Yeah.
And what was the outcome of the study? Were you able to compare it against physicians?
Yeah, in that particular case, it ends up with better diagnostic outcomes as measured by, did you get to the correct answer? And
how much better?
So the important thing here is these were diagnostic challenges that were published in New England Journal. So humans are almost by design bad at this. These are really, really hard problems. But the answers in some sense are in a textbook. And so the models are very good. What's more interesting is as they do that, they can make better utilization of the medical system. Because you could also measure, well, how did you get to that answer? Was it just asking questions? Did you order an MRI? Did you order a really expensive biopsy? The most important thing is to get to the right answer, but sometimes you can get there through a less resource-intensive way. And so you can by getting the models to think about it holistically, you can actually get to a better answer in a better use of resource, whether that's dollars or whether that's time. Now, I want to be clear. The goal for us as Microsoft is not necessarily to build these systems as a final product necessarily. It's more to show what's possible and to build these tools in such a way that others can build on top of those. How do you empower somebody to get a really good model and then plug that into a system where others can then consume that?
And you mentioned that if we're truly to try to understand what the role of the physician is in 3 years and 5 years, and it probably means judgment's going to get really hard. You're asking supercomputers really complex questions. But shouldn't physicians be training for this now, which means AI should be incorporated into medical schools? So when you're graduating, you're ready to use this tool. Is that happening?
I mean, it's spotty, I would say. Look, I think this is a bigger question that you studied this yourself, of how do we actually incorporate AI into all aspects of education? The dumb way to do it is to use it cheap. That doesn't help anybody. But there's ways that you can use AI just from testing mechanisms, from tutoring, et cetera, et cetera. I think the more interesting question is, how do you start training physicians to use the AI in their practice? And how do you do it in such a way that they still learn the fundamentals of medicine, develop a taste, if you will, for how medicine should be done? I think that boundary is going to be really interesting to figure out, how do we do that well?
I think a big concern people have is empathy, judgment. Where is the human in the future of care? And you describe it as, if we can bring more care to the patient so they don't even have to go seek it, that's actually a win for everyone. But I think there is a legitimate fear that you don't want to be alone in your healthcare journey entirely. So where do you think that evolution happens?
It's hard to predict the future, but I think we as humans need human interaction, need human touch, need human judgment. And that's not just a text box saying, here's what the right answer is, but as somebody that can sit next to me and cry with me, as somebody that can really help me walk through that journey and get to the answer for what that's I need. I think we see this very clearly with the role that nurses play in medicine right now. It's not just about do the thing, but do the thing with you and help you along your journey. So I think that human element will always be critical. I think the framing the question of will it be an AI or a doctor is just a false dichotomy. It will obviously be both.
I agree. And as you had mentioned, different people will be doing different aspects of the care. So we say we do want human empathy and a human touch point, but who is doing that care in a world where AI could help with diagnostics? Maybe that means you interact with the nurse more, or a different type of caregiver. And that is the true impact of a system-wide change. We don't recognize the world that we live in, and that's also possible.
Yeah, we also want our human to have all the tools available that they have to make the right decision. If
there was one thing that you wish people knew or understood about AI in healthcare, what would it be?
If you reflect on the history of medicine, it is replete with inventions of new tools that fundamentally change how medicine is practiced. I think back to the invention of the microscope in the 1800s. It wasn't just now there's a new tool that doctors could use. There's a whole new discipline, a whole new specialty, a whole new training mechanism to actually learn how to use this. There's other examples. Obstetrics is a great example where when ultrasound was invented, there were lots of concerns about what's the safety of this new technology for the mother, for the unborn baby. Should we use it? Should we not? But now if you go to an obstetrician and they say, I don't believe in that stuff, I'm just going to use my fingers and trust me on this one, I think that would be medical malpractice. These things evolve over time. I think what's different now is rather than having a very specialized tool that will lead to more specialists, my hope is that as a general tool, we can actually diffuse the specialty back down into the front line of medical care, because the reality that medicine is more complicated than any one person can understand.
I love that. That's a really fascinating way to end. Lots to think about. Thank you so much. It has been a pleasure.
Thank you.